care immediately. This could cause a situation where the virus is more likely to spread and increase the difficulty of controlling the outbreak response. So we did not stigmatize persons who have recovered from COVID-19 or even those who just barely tested for it. Having said that, I want to strongly advise that persons who test positive for COVID-19 enter into accredited isolation and treatment centers for proper management. This not only gives them the best prospect of survival and recovery, but protects their family, friends, domestic and office staff, and the community they live in from infection. If not, it will be counterproductive. We have developed various isolation and treatment facilities to meet all needs and expectations of security, privacy, and comfort. And I therefore urge citizens to cooperate with case managers. The fight against COVID-19 is like climbing a steep hill where we cannot yet see the summit. It is hard, persistent work. We must persevere together to succeed. The whole country is in this together, as the same with the global community. I urge you all to stay at home, stay safe, except you really must go out. And if you do that, remember the advisory for hygiene, respiratory hygiene, and also social distancing, and the use of sanitizers and a mask, especially including improvised masks, especially if you know you will encounter a crowd or you find yourself in public transport or any other place where people have gathered. Thank you. I shall now invite the Director of CDC to speak.
Chair, Honorable Ministers, members of the Presidential Task Force, ladies and gentlemen. So I'll start from where the Honorable Minister stopped, because there's an important issue we've been dealing with on our social media handles throughout the day. People have been asking questions. Where are the people living? Where are the people with COVID-19 living? What part of town are they in? What part of Lagos do they live in? So COVID-19 is a pandemic that has hit the world and disrupted lives in an unprecedented manner. With the constant reporting of cases every day on TV, on all our channels in Nigeria and abroad, of course everyone is anxious and frightened. Unfortunately, this anxiety seems to be leading to stigmatization. But those of us that have worked in public health know that we've been there before. When the HIV epidemic hit our world, we did the same thing. It was even worse because it was a sexually transmitted infection. But this is an infection. It doesn't get to you because you've done anything bad or you've committed a crime. It doesn't get to you because you're an elite or you belong to a certain strata in society. It is not karma. It's not coming back to you because your forefathers did something wrong. It is just a virus. And we have to really think about how we treat people and how we continue allowing the humanity in us to always come through. The people that are infected have families just like every one of us. They have mothers, sisters, brothers, wives. They need to be respected. It affects their mental well-being. Of course it affects their mental well-being. If our response as a society is to stigmatize them, it is preventing our work from happening because some contacts are choosing not to come forward, to hide, to run away, not to answer their calls because, as a society, we have started stigmatizing them. So this is really to appeal to all of us. You know, what makes us a great nation is our humanity, our love for each other. It is what has made Nigeria always stand out. If we start stigmatizing people because of an infection, it will not only disrupt all the great work being done across the country, but it will have a profound impact on our ability to control this outbreak and our ability to get back to life. So as we roll out testing, as we increase our testing, with all the pressure we've had to do so, it will be counterproductive if at the same time we stigmatize those that we're now finding to be infected. Because what will happen is that people will go underground, they won't come forward for testing, but they will be infected. And by being infected and staying underground, you infect others. And the cycle will continue. And the disorganization in our society will continue. And our economy will not be able to come back. So all these things are connected. It is not, we're not asking you not to stigmatize out of some hypothetical risk. This is a real risk to the challenge. So if you're tired of staying at home, if you want to get back to life, please support those infected, support their contacts, encourage them in any way you can. Call your friends if you know who they are. Show them that we support them, we're waiting for them to get well and come out. We've so far discharged 128 people. 128. Show them your love wherever you are. Reintegrate them into our society. As I emphasized last week, that while we maintain a reasonable fiscal distance, we do not want to be socially disconnected. In fact, at a time like this, we need to be more connected than ever before. In these times, what unites us is more than what divides us. Let's show empathy to others. Together, we can take responsibility in the fight against COVID-19 and associated stigma. Thank you very much.
The Secretary to the Government of the Federation, Honorable Ministers, members of the Presidential Task Force, ladies and gentlemen of the press, good afternoon. So, first of all, I'd like to talk about the issue of travel restrictions and to re-emphasize the need for people to stay at home, especially in the FCT, Lagos and Ogun. I would also like to briefly note the issue of people traveling in between states, interstate travel. We have noticed that community spread is now being traced from people traveling across state borders. We need to try and restrict our movements in order to stop the spread of coronavirus infection. This is particularly pertinent with regards to the news of people being smuggled in trucks out of Lagos, which is quite concerning to us. Moving on to the issue of distribution of palliatives, I would like to highlight the need for donors to safeguard life and basic health protocols during the distribution of palliatives within local communities. It is important that they maintain health and safety. The rise of aggressive behavior and the non-conformity to physical distancing is unacceptable and is a major risk to our communities. It's a serious public safety concern. I enjoin donors to work closely with local authorities and to ensure that the mass gathering restrictions and the physical distancing guidance that we have given is abided by. On the same issue of donors, I would like to remind donors that intend to support the COVID response on the importance of working with us through the Presidential Task Force to make sure that donations are relevant to our needs. We need to make sure that we do not purchase substandard goods or put quality assurance standards aside in the process of trying to increase our resources for the response. This is particularly valid for state governments as they go on to purchase PPEs for their healthcare workers as well as frontline staff. We will be providing guidance on the sort of standards we expect, which is derived from international standards, including the WHO standards for PPE and other equipment for the response. Finally, I know previous speakers have talked about the issue of stigma, which continues to be of concern to us. I would like to appeal to survivors of COVID to please tell their stories, but at their own discretion and for the purpose of reducing the stigma and discrimination associated with this illness. We can see how celebrities and other persons from outside the country are working very hard to enlighten the populace and prevent discrimination and ignorance. This has worked with other disease conditions such as HIV, and we are certain that it will work for COVID as well. While doing this, while supporting us, it is important that we continue to respect privacy. But if you are a survivor of COVID and you are willing to share your victory, because it is a victory, then this will definitely help us towards getting on top of the pandemic. Thank you very much.
Thank you very much. We have completed phase one of this national briefing. We shall now take the questions. We'll take 1 to 9.
Good afternoon, the Secretary to the Government of the Federation, Honorable Ministers, the DG and CDC, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My question is directed at the SCDC boss. Recently, we've seen countries like South Korea experience relapse. People with that tested positive were treated, became negative, and then they are positive again. What mechanisms do you have in place to ensure that we don't have such experience in Nigeria? And is there any form of education or advice you would give to Nigerians, maybe to families of those that have recovered and people around them? Secondly, my question is directed at the SGF. At the inception of this briefing, you made it clear that the PTF committee is working hand in hand with state governments to ensure that this whole project comes to fruition. Now, 2 days ago, the Adamawa State Governor lifts a ban on restriction of movement and other measures put in place. Don't you think this will jeopardize the efforts of the PTF towards curbing the spread of the disease? Thank you.
Good afternoon, the Chairman, Ministers, my colleagues. My first question is to the Minister of Health or the NCDC boss. Medical personnel who would love to volunteer to tackle the COVID-19 would like to know how to go about it. And then secondly, since we started the community testing in the FCT, we would like to know the success rate and how many we've tested so far. Thank you.
Good afternoon, SDF and members of PTF and my colleagues. My name is Mwanga Marachi, Voice of Nigeria. My question goes to the Minister of Foreign Affairs. I'll take first in English. There was a debt weaver from the IMF to some African countries. Nigeria was excluded. My question is there any plan by the federal government to persuade the IMF to consider adding Nigeria to this relief, considering the impact of COVID-19 in the economy? And secondly, there has been several harassments and attacks on people and by security agents during this lockdown. Just about 48 hours ago, the news we have on social media and from some newscasters that people were killed, lives were lost in Onitsha and Delta State, as well as Abia State, where a civil defense officer shot a driver conveying food items to a destination. So my question is there any other measure that can be put in place to address this? Especially some of our colleagues that go out daily still experience the harassment from these security agents, stopping them and not allowing them to get to their place of work. So the IG is not here. Maybe the chairman can answer this if there are other measures that can be put in place to address this. Thank you very much. Nasusibo, Nasonsa, Otumbu wana homaka, mbazinye ego, aboro IMF. Where Otumba ndi Africa ha were poro ego nke ha biri. Naju, ka emere ihe a, ala Nigeria esoghị na ndị agụpụrụ na ego ndị a gbatinyere. O nwere ka gọọmenti etiti si eleba anya na nke ịhụ na ha yọrọ otu IMF ka ha nwee ike kpọbata ala Nigeria, ka anyị hụrụ na ọnọdụ nke ọrịa corona butere ugbu a o dewela ụwa dum na ọnọdụ ihe ịgba anya mmiri na nhụju anya. Ọ ga-amasị m ma ọ bụrụ na a ga-asị nke a n'asụsụ Igbo. Thank you very much.
Good afternoon, Chairman and Ministers. My name is Femi Ogunshola. I am with the News Agency of Nigeria. So, considering the fact that the task force is making frantic move to forestall the further spread of COVID-19 to the country hinterland, sir, don't you think the National Orientation Agency is actually critical to stop the spread of this virus via sensitization, creating awareness, and because I've seen some comments, especially on social media, saying NOA is not actually doing enough and stuff like that. And the ministry, the agency, some of the agency staff are actually accusing the Ministry of Information of actually trying to take up their role. So what do you think can be done to bring in the NOA? Thank you.
Good afternoon, sirs. My name is Shaki Hassan from Voice of Nigeria, the Arabic service. I would like to speak in Arabic for the benefit of my listeners. السؤال الأول: هل يوجد أجنبي من الذين من ضمن هؤلاء المصابين في نيجيريا؟ الثاني: هل هناك قائمة صحيحة حول عدد الأجانب المقيمين في نيجيريا؟ وهل هناك خطط لاستفادة من مساعدات الحكومة النيجيرية؟ I will speak in English. My first question is, do we have a foreigner among the confirmed cases in Nigeria? That's the first question. And sorry, my question goes to either the foreign minister or the Minister of Interior Affairs. The second question is, as we all know that there are foreigners residing in Nigeria, either legally or illegally, and it's not all of them that is doing well financially. Is there any plan that they are going to benefit from the government palliative? Thank you.
Good afternoon, Mr. Chairman, members of the PTF, my colleagues. My name is Mohammed Salih Nazif. I work for Voice of Nigeria. I have two questions, one for SDF and another one for DG NCDC. Let me start with DG disease control. Sir, in your submission the other time, you alluded that a clinical trial and research is ongoing in respect of finding cure or vaccines that has to do with COVID-19. As it is now, I want to know if there is any collaboration between NCDC and our various university research departments. Are you carrying them alone? Looking at universities are down now. To SGF, I don't know if government has budgeted specifically money for research in the area of finding cure for COVID-19. Thank you.
The Chairman, National Coordinator, Honorable Ministers, my colleagues. My name is Amaka Ote. I report for Arise News. And my first question really is to the Minister of Health or the DG of the NCDC. Well, we do know that we have been working to improve our testing capacities across the country. But till today, how many tests have we carried out since the pandemic started for COVID-19? So I would like to get an update on that. And the next question is for the Minister of Interior. Well, this is a question that came in from a civil society organization, and they're asking why you have not made public the names of the 2,600 inmates that were granted freedom by the president. And also, they need to know the state, something about the 2.1 million naira, that some sort of contribution. So they said he would understand what they're referring to because they had written to you to get an update of that. And finally, really, the next one is to the Minister of Information and Culture, Lai Mohammed. Well, yes, I do know that, yes, with this briefing every day, more and more Nigerians are becoming more aware of coronavirus and the magnitude of what we're dealing with. But unfortunately, even the satellite towns in Abuja, it seems people don't know what we're fighting against. People are still going about their regular business. Some of them, maybe they don't come to the towns, they don't go to their stores. But in the satellite towns, people are exercising in their hundreds. No social distancing, no one is wearing any mask, and I'm worried about the community spread. So really, how are we targeting this group of people, beyond even the FCT and other states as well, to get them to be more aware as to what we're dealing with? Thank you.
Good afternoon, Mr. Chairman, PTF members, and my colleagues. Rachel from the News Agency of Nigeria. My question is for the NCDC DG. So I would like to know if Nigeria have a uniform guideline for discharging patients treated for coronavirus. Now, the SGF made mention that we can now use our Ankara and Shedda for face masks. Now, if the surgical mask covers 22 to 65, if I'm not right, percent of particles, is it any kind of fabric we are meant to be using to make masks? Thank you very much.
Good afternoon, Chairman and members of the Presidential Task Force and my colleagues. My name is Mitaire Ikben. I report for the Nigerian Television Authority. I want to ask, is there any grant for the garment factories and tailors to encourage the production of face masks at this time? Is there any specific grants for them? And again, the Honorable Minister of Health said that there is no shortage of personal protective equipment, but some health workers in some hospitals in Abuja, especially the FMC Jabi, are saying that they don't have enough personal protective equipment. So I want the Minister of Health to respond to that. And when will the distribution of palliatives to senior citizens and the aged commence? Thank you.
Good afternoon, members of the Presidential Task Force. My name is Yemi Adebayo from AIT. I just have two questions for the BTF this afternoon. The first goes to Minister of Foreign Affairs. There are a lot of Nigerians who are stranded there and wants to return home. And I can remember vividly last week, you did say that the ministry is meeting with the various embassies of the country outside to actually collate the number of those who are willing to return home. I want to find out, have you done that? Then what sort of measures are you going to put in place immediately you collect the number of those who want to return? Yes, sir. I think the PTF will need to meet with the top security chiefs in terms of enforcement of lockdown. A lot of Nigerians are complaining that in the process of the security personnel enforcing this lockdown, there is a high level of infringement on their rights. Their rights are being infringed upon. Some perhaps being beaten up for not following perhaps the processes or not. So I want to find out, are you going to meet with security operatives to actually talk to them to be more civil in terms of dealing with Nigerians at this time? Because 2 weeks lockdown just gone by, we are in a new one, and people are really not too comfortable with the situation we are now. Thank you very much.
Thank you. That brings us to the end of the questions. The questions have been directed at the Honorable Minister of Health, the Director General, NCDC, Honorable Minister of Foreign Affairs, Honorable Minister of Information and Culture, Honorable Minister of Interior, and the Secretary to Government of the Federation. We shall begin with the Honorable Minister of Health. Minister of Health, please.
Thank you very much for the questions. They are cross-cutting, so I will answer those ones that are in the health sector, particularly with public health. The DG will address those ones. Now, I will start with the question of the spread of the virus and the orientation and awareness creation. The virus is carried by people. Persons who move from one place to the other. Many of them may not even have any symptoms at all. Some may have symptoms and think they better run home to go and cure themselves. Maybe get to the village or get to their community. And that's exactly what the lockdown is supposed to prevent. Because you move from one place where the virus is prevalent and carry to another place where it is not prevalent, you are going to endanger the community. The lockdown is to stop people moving and probably mistakenly taking the virus to where it was not before and we don't want it anywhere. So we urge people again to respect the lockdown, stay where you are, and follow the advisory. If you have any symptoms, go straight to see a doctor or go to a site where you can get testing so that you can get your treatment exactly on the spot instead of traveling in a bus in which many people inside the bus will be endangered, or going to a community where people who didn't have COVID now get it from you. That is not a good gift to take with you anywhere. So clinical trials, yes, there are clinical trials that are going on. The World Health Organization set out an initiative called Solidarity that is to collate experiences from various countries treating coronavirus infection using different protocols. And the Nigeria centers are participating in that and studying what they need to do to contribute to finding a solution. A lot of them are just trials in that what works is not really definitely clear. Then the question of shortage of PPE. There's a global shortage. If you look, if you watch TV, you'll see that even highly developed countries who are industrial countries are complaining that their health workers are short of materials, and some have to look for improvised wear. So there is a global shortage. Manufacturing companies have either reduced their production due to the restrictions from the virus infection, or they are not able to meet all the needs. That's the reason why we are very keen on having a stockpile so that we don't get into a situation where we run short and not give those who need the equipment and PPE what they want. Every hospital has been given a starter pack that you have something on reserve to use just in emergency. If you're actually treating cases, then you will get more. But we are not just distributing them equally so that people can put in their store. We are just giving something that you need, and immediately you have cases you are dealing with, be supplied with more and leave the central stock to be better managed. These equipment are very valuable at this time, and they need to be used judiciously and wisely. Now, some hospitals that are not directly handling the coronavirus will only just have a few sets, and they will be able to get more if they require more. As for the discharge is that a person will test negative for the coronavirus 2 times within 48 hours. So if you are tested, you are negative, you are tested a second time after 48 hours, some people make it 24 hours, if you are negative 2 times, then you are good to go if there are no other complications. I think that's what that concerns the health sector.
So thank you, colleagues. There was a question on South Korea and the patient that apparently got reinfected after testing negative the first time. So there are some questions that we will just need some time to answer. Some viruses give a long-term immunity once you've had the first one. The one that we know the most is yellow fever. Once you're infected or you've had the shot once, you're protected for life. Others provide shorter-term immunity, and then you can get the infection again. You need time to study this, and until we have sufficient time, we're not able to really know whether this was an exception or the rule. So we'll keep following up on each of our patients. There are some studies going on already on survivors, people that have recovered. Let me not call them survivors, but people that have recovered and reintegrated into society. So we will think of doing some of that in Nigeria as our patient volume increases. The other question on volunteers, the work that we do is very specialist. It's just like, it's not something you just bring people together and start doing. So what we have a pool of graduates from the Nigeria Field Epidemiology Training Program that are around the country in various jobs. What we have done is gradually integrate them into our workforce. We work with them on outbreaks all the time. So whether it's cholera, Lassa, monkeypox, that's our primary source, at least for the work that we do from the NCDC perspective. And this is very important for people to understand. There are many requests about volunteering, but it's just like, the easiest example to give is the military. You don't just bring people together, give them guns, and say, okay, go and fight. It does take a lot of learning, dedicated efforts. Yes, we have to shorten that period in certain cases now, but a certain level of preparation is still needed before you go out to do this work. The question on research on the universities, absolutely. Universities don't need to be carried along. This is their core mandate. So nobody should wait to be carried along in this work. Everybody should come forward, bring out their ideas, put them forward, and get on with it. The primary institute at the federal level is the Nigerian Institute for Medical Research in Lagos, and you would see their work around sequencing the first virus. So they've been very proactive around this. I think they've just announced they've sequenced 2 more. And so they will be leading kind of on the federal side for research. But we have universities, and that's the core mandate of universities. The question on, I think Amaka asked on tests, we've agreed every Friday at 6 p.m. to announce the number of tests for that week. So look out for it this week. So far, we're just around 7,000, but we want to release the numbers and potentially even a breakdown of what we've tested in every lab within the network. So 6 p.m. every Friday we'll announce those numbers, so you'll have a picture for the week just passed. I think those are all the questions. The question of mass, on what material to use. You know, the use of cloth mask is really as a physical barrier. The viruses are very tiny particles, so none of it will completely protect you. But on the balance of evidence, what we've said is better that you wear something that reduces, especially when you're in that pre-symptomatic phase. If you're transmitting virus, reduces the burden of that transmission by 50%, 60% is something. So that's really the thinking around that. The mask itself, we can't say it's, you know, the different materials. No analysis has been done on what material is more protective, because the whole thing is really a compromise situation to reduce the burden on transmission, especially in crowded places. And I think as we approach the end of the lockdown, we will gradually take things like that a lot more seriously. And especially in places like markets, you know, places where physical distancing is difficult. We will have to emphasize the use of masks in those settings, because the principle that we talk about, the physical distancing of 2 meters, are very difficult to implement in certain settings. So in those settings, we'll be firmer in the use of masks than maybe other settings where we can actually apply that principle of physical distancing in the closeness of our interactions. So I think that answers all the questions.
N'izu ụka gara aga, ajụjụ ha jụrụ m si m ụsọ n'Igbo, asụ m n'asụsụ ndị agbaenu. So ndị be anyị si m ụsọ n'ụwa awa, na-abụghị ịwa awa. So eke nwa asọ n'ụwa awa, amụghị eke. So unu ghọtakwa na ọkara mma. Mana ajụjụ ha jụrụ m bụ ihe gbasara Ohu Bank na-achụ n'ụwa ụwa ha na-akpọ International Monetary Fund. Ashịda na ego na nwere obodo iri na asatọ, no, 19 na ha yechiri ego ka ha were n'ụsọ ayanwa ọgụ. Mana na ha yeghị Nigeria, so ndị ha ka eme ka ha yeghị ndị Nigeria. Mana ihe mgbe ha yere ya bụ ego, ha yechi ndị obodo ego ahụ 19 na ha chere n'ọsọ obodo dị ogbenye na-enweghị ego ncha ncha bụ ha họpụtara ya bụ ego. And unu amara that na obodo anyị nwere Nigeria, I said that na economy anyị bụ kacha n'Africa niile. So mgbe a na-ekekwa ihe eke ndị obodo ndị ogbenye anyị aka eso n'ime. Mana adị m sure na minista anyị na-enete finance na ọ ya eme nnọọ ike ka a họpụta Nigeria na-anọkwa eke ego ọzọ dịka So what I was saying was essentially that, the last time actually I spoke in Igbo, I spoke in Central Igbo, you know. So a lot of people wrote to me and said, hey, look, listen, you know, you're a Wawa and you should be speaking the dialect. So that this time I'm going to to speak in a dialect, and I hope that the questioner will understand my dialect. On the issue of evacuation of Nigerians, where we are now is that we have received all the numbers from our various embassies around the world. We are collating those. Then we have now selected 2 airlines that will be responsible for going to fetch them. The numbers are high, and the places where we can isolate them are not enough for those numbers. So we will have to do it in a staggered fashion, and together with the National Emergency Management Agency and the Ministry of Health, we will have to come to an agreement to be bringing back according to the numbers of beds and so forth that are available. But as I said, we have now identified the airlines that will go out in the process. So we're almost ready to go. Thank you very much.
Honorable Minister of Information and Culture.
Thank you very much. I'm sure you don't expect me to answer the one in Arabic. Before we go to the Arabic one, let's treat the one in English. The allegation that the Ministry of Information or the PTF or in particular the National Orientation Agency is not enough to sensitize Nigerians, to enlighten Nigerians about COVID-19 is fake news. It's fake news and it's fake news. And I have the independent polls conducted by the NOIP, which is the most credible company in the whole of West Africa for this kind of polls, which was also sent to us by the UK Prime Minister's Office Communication, which is partnering with us. And the result is this. It says 99% of Nigerians say they are aware of COVID-19. 6% of Nigerians say it is not real. And of this, 6% is broken down to Northwest, 4%, Northeast, 8%, North Central, 5%, Southwest, 3%, Southeast, 10%, and Southeast, 12%. The poll also asked Nigerians this question, and it said that 28% of Nigerians say they are immune to COVID-19. And the reasons they gave are as follows. 42% of them said, I believe in God. 35% of them said, I follow preventive measures. 11% of them said, I'm a black person. 5% said, hot weather will not allow it to catch me. While 4% says, I eat good food. The poll also went down to ask Nigerians, do you think the FG's decision to lock down FCT Lagos Ogun is correct? 18% said it's too extreme. 77% said it's appropriate, while 5% said not sufficient. So if you want more information, I'll give you. But I tell you, this is not from us, from NOI polls. So all this, allegation that there's not enough, public enlightenment is fake news. Thank you very much. The Arabic version and next session.
Thank you very much, Honorable Minister of Information and Culture. We will now take the Honorable Minister of Interior.
Good afternoon, all. I will start with this general message. We must commend the endurance and resilience of all Nigerians over this period of a national war against the invisible COVID-19 on all space of Nigeria. The war is grim and tasking. We must thank God for His mercy as we are thanking our fellow compatriots and the frontline and health workers for their resilience and commitment. Let me seize this opportunity to admonish Nigerians living in our border communities in the states sharing borders with our West and Central African neighbors. And these states are Lagos, Ogun, Oyo, Kwara, Niger, Kebbi, Sokoto, Zamfara, Katsina, Jigawa, Yobe, Borno, Adamawa, Taraba, Benue, Cross River, and Akwa Ibom. These are the states ring-fencing Nigeria from our neighbors in the west to the north and the east. I'm seizing this opportunity to admonish them to promptly report any illegal entry of anybody across our borders and alert the officers and men of the Nigerian Immigration Service. It is in our collective interest to prevent opportunistic entry of COVID-19 into Nigeria by any means. We, as a people and a nation, have sacrificed a lot of our time, energy, resources, and wealth as a people and a nation, that it is best to take the maximum advantage of the gains we are making on the containment of this virus by being alert to any movement at all across our border by anybody except our own citizens, who even as well we must report to the officers and men of the Nigerian Immigration Service. These gains come at a very, very high price. We're all paying it. It's taking tolls on our economy. It's taking tolls on our spiritual life. It's taking tolls on our social life. So we must therefore not take it for granted. We must support the government to keep our borders secured against the virus. This said, I owe the lady who spoke in Arabic first and later English just this answer. In the speech I made on Thursday last week, while delivering the president's message on the release of some inmates in our custodial centers, I titled that speech, "Compassion is the basis of morality." It's not a slogan from me. One German writer said so, and I agree with him absolutely. Our hospitality, our philanthropy, our high sense of compassion are the classical hallmark of Nigerians. So, no foreigner from West Africa, Central Africa, or outside Africa will suffer neglect or lack of care in any part of Nigeria from Nigerians or by Nigerians and the government. That explains that. Identities of freed inmates. From the speech again I made during that, when I was announcing the presidential amnesty, I was clear that the federal offenders that are to benefit from that first phase, because it's just the beginning, and I made it clear in my speech that that will be beginning of the exercise. It's going to run for quite a while because of the number we have there. The number of federal offenders that were given amnesty was 70. That the remaining 2,600 were state offenders. That based on the criteria established, the president has approved for the Attorney General of the Federation to contact respective states, and I gave the number of beneficiaries per state that the Attorney General will write on to the states to release, and they are releasing them. I've read about Kaduna and some other states. So please, it's unfolding. And it's not even limited to what we have done. We are committed to decongesting our custodial centers. I could not get the second question about 2.1 million or something. I want to assume the lady from Arise should by now have the correct thing about that amount of money, what it is meant for, what she wants to know about it. I wouldn't know. So if you can please explain yourself, I might be able to help. Okay. Thank you. I've now understood you. It's 21 million, it's 21,500,000 naira. Please. When it comes to money, everybody is sensitive. What I said in my speech on that day was that as a condition for releasing some, about 800 of the inmates, is the need to pay fine. And we pegged it at those who have a fine obligation of maximum of 50,000 naira, that we have penciled them for release, and that total sum is about 21,500 naira, which we expect the state governments to pay to themselves. Let me explain this because this is quite interesting. FCT paid for his own inmates that fall within that bracket of inmates having fine obligation of maximum of 50,000 naira or below. FCT paid his own sum. I couldn't recall the figure now. And we recommend to the state governments to equally do the same. And let me explain to you what we mean state government paying to itself. A court judgment is already an obligation that cannot be obviated. However, if the state government pays the fine to its state judiciary, the money goes through the state judiciary to the treasury of the state. And it's the state paying itself. It cannot be waived because it's an obligation, being an order from court. So the order must be obeyed by the government paying the state judiciary, and the judiciary dropping it in the state treasury. So it's into me. So it's 21 million naira, 500,000. It's 21,500,000 naira. It's not coming to federal government. It's going to each of the states that have recommended those inmates for release with the fine obligation. I hope that is understood now. It's 21 million. It's 21,500,000 naira. Now on garment. I know the chairman will talk on this, but it's always nice to use the opportunity of this engagement to sensitize our people to what we owe ourselves. It's getting very clear that the tropics does not allow people to huddle in their houses. The tropic is an open space where intensive social interaction is natural. if that is the case, and we now have to live this very difficult and strange life of being indoor, it will be inconceivable, and may God not allow it to happen, that we stay indoor forever. But for economic reason, social reason, spiritual reason, we can't. If that is the case, the only thing possible, therefore, is to have a minimum prevention system, a minimum system of ensuring that people are prevented from being infected by this virus. And the face mask, to observance of physical and social distancing, personal and hygiene are maintained. So if that is the case, let's take our population to be 200 million. Let's say half of that population are active, semi-adult to full adults. It's more than that, but let's even say half, 100 million. Let's now assume that the cost, I don't know, I'm just assuming, don't quote me. Let's assume that the cost of local production of this guard is 500 naira. That business alone of mass production will generate a 50 billion naira business. So if that is so, I want to recommend this. Rather than look at government for grant, let individuals that can mobilize seamstresses in their respective area to produce this thing and help people in the community. Let chairmen of local government areas, let councillors, let officials of government and those with means support this exercise by mass producing from local producers, seamstresses, ladies, women who can do this. We have been told by experts that our ordinary textiles can go a long way in producing this mask and serving the purpose of preventing the droplets of the virus from attacking us. So I'm with this appealing, or I'm by this appealing to all of us that have the capacity, one, to organize seamstresses in our respective communities, leaders of community, leaders of religious organizations, leaders of associations, trade and social, political leaders, everywhere. Let's come around to support the containment of this virus by mobilizing those with capacity to produce masks with our cloth that we can use year round. I'm quite hopeful that with this, in no distant future, Nigeria will be a safe haven and a no-go area for coronavirus. I thank you for your attention.
Thank you very much, Minister of Interior. We shall now take the Secretary to Government of the Federation. Just to wrap up, sir.
Yes, sir. Thank you so much. There was this question that had to do with sending you with the states, as if we are not working in concert. Paragraph 2 of my speech this morning did emphasize that when I said that the Presidential Task Force continues to monitor developments around the country and provide guidance to the subnational entities and all other Nigerians on measures being taken. We are working in a collaborative manner with states all over the Federation. I have been in contact with them through the Governors Forum. And even yesterday, after our video conferencing meeting with the President, the DG Center for Disease Control and the national coordinator of the PTF. We're on with them for several minutes discussing synergy and how we can harmonize our response so that we have one national response. I must commend the states because they are doing a good job. But you heard me say this morning that this is not the time to relax any lockdown. The state has gone from one index case in under 1 week to 21. So it's a serious business, please. It's not a joking matter. And this is not the time to play any game. It is only our collective resolve as a country that can help us deal with this pandemic. So I'll continue to emphasize the fact that we have one national response and scientifically proven the only way you can drastically reduce transmission is through the lockdown. Once people don't come in contact with each other, we'll be able to trace those that have appeared on our radar as persons of interest, follow them up, track them. If need be, test them. If they are positive, take them into isolation, remove them from cohabiting with other people that are not infected, take them into isolation, and give them the appropriate care. But as long as we allow business as usual, people getting together, partying, then we should be prepared. We should be prepared to deal with the consequences of our actions. So I will continue to make this a passionate appeal. That given these 2 weeks, I must commend the governors that have taken bold steps in locking down their states so that the needful be done. The Quarantine Act signed by Mr. President has direct bearing on Abuja and Lagos and Ogun. So we have responsibility to ensure that this lockdown in these 3 locations are effective and geared towards producing the desired results and objectives for which the extension is granted. And that brings me to the second question that talks about difficulties of accessing movements and harassment by the law enforcement agencies. I'm not holding brief for the Inspector General of Police and all the other security agencies. But you know where I stand on this matter. I've spoken about it some time ago when I said it's a Nigerian phenomenon. And civility is reciprocal. If you are civil in your approach, you ordinarily attract a reciprocal civil attitude from the other party. And it's a cultural issue, it's a mind issue that I believe strongly that in spite of what COVID-19 is doing to us as a people, but coming out of it, I believe we will learn very good lessons and we'll begin to deal with matters and deal with ourselves in a different way. expect that our security agencies will be polite in interrogating whoever desires to have access during this time of lockdown. And that was why I said in my speech this morning, when I said I was requesting the security agencies to please exercise patience in communicating. I mean, our people should exercise patience in communicating with the law enforcement agents assigned to ensure compliance with the presidential orders. They are there to protect us. But in the same vein, the security agents too are not expected to be overzealous in dealing with our people. I totally agree, having been locked down for 2 weeks, and particularly for those that earn their means of income on a daily subsistent basis, there is anxiety, there is apprehension, and the pressures of life kick in at that particular moment. But this is a time that we must exhibit decorum, we must be patient with each other, we must try as much as possible to endure and accommodate sometimes even excesses. Knowing the Nigerian people very, very well, because I'm one, this is not the time to take undue advantage. This is not the time to take undue advantage. This is the time to show our true sense of nationalism in this regard, and to ensure that we do everything collectively to have an upper hand in our fight against COVID-19. So in summary, what I'm trying to say is that as much as possible, the security agencies should be patriotic in their actions, should be accommodating, should be polite, and should restrain themselves even in the face of provocation. But in the same vein, the civilian population too should be civil in their conduct. And lastly, the question that has to do with whether we have a budget for research. I can assure you that we have a budget for research, and we are partnering with the Nigerian Institute for Medical Research, because this is a novel virus. Even from the place from where it originated, they are busy trying to lay their hands on possible vaccines or other drugs that can be used for the purposes of cure. So every country is mixing whatever they can mix. Here in Africa and in Nigeria in particular, we would put a little bit of the Nigerian sense in it, like the Honorable Minister for Aviation said here, in his part of the country where he comes from, people are saying that they can eat some fruits, they can swallow some things, but that is not scientifically proven. We would do the needful in terms of a proper medical research to see if Nigeria can have a leeway or a headway in getting to the creation or invention of a vaccine or a combination of drugs that can be curative dealing with the coronavirus. As of now, there is no cure that has been proven scientifically. There is no vaccine in the market that can be administered. All we are doing is to put in place the non-pharmaceutical initiative and the medical care that can be given to those that have been infected. I want to thank you.
Thank you, SGF. That brings us to the end of today's national briefing. One significant message that has come out today is that please do not stigmatize anyone who has survived COVID-19 infection. The virus does not discriminate. Allow the humanity in us to always come true. I thank you very much for being part of this program. Particularly, I must thank all the media houses that have transmitted live. I thank NAPTIP and Sight Savers Nigeria for supporting us with the sign language for today. God bless all of us. Thank you.